Governor, how will Utah's healthcare reforms lower costs and expand coverage?
Well, our approach in Utah is to give consumer more choice. And if we can put them in a control position where they're spending dollars that are their own, they're going to make better choices for their own unique circumstances. So with our health exchange, we are now giving small business the opportunity to give defined contributions as opposed to defined benefit. And that's going to introduce competition from the providers. We've had tremendous success. We opened it up in 12 days. We had 99 businesses covering 3,500 employees that wanted to sign up. Now these are just small businesses of 50 or less, but next year we'll open up to all businesses in the state of Utah. That's going to make some predictability for the business community where they have a defined contribution. It's going to put the consumer back in charge of spending their money. They can add to, take from, and go to this window, which is kind of like a Travelocity.com. You have an opportunity to look at many different plans uniquely suited out there and find the one that will work for you and your family. And I think it's going to be a significant step in the right direction of private sector competition with the consumer in charge and with predictability for the business community that's going to help bring down costs for healthcare.
So do you think Utah is an example where state-based reform is better than one-size-fits-all federal mandates?
Well, I believe we are, and I think other states could be the same. I mean, it really ought to be the states leading out, in my view, on healthcare reform. You have 50 states that all have the ability to kind of come up with a best practice, a best idea, to be innovative in trying to find solutions to the healthcare issue. And as opposed to Washington, D.C., which has one shot at getting it right and finding something that fits for everybody, it never has and never will be a one-size-fits-all that will work. So why not have 50 states doing it, having them find their own unique needs and challenges and find solutions? Some will be successful, some won't. We'll learn from those failures, we'll learn from the successes, and eventually over time, I believe you'll come up with kind of a uniform approach to healthcare developed through the states. And again, they've always been little incubators of innovation and creativity. And states want to be partners. That's the sad thing about this, is the states are being frozen out by the establishment here in Washington, D.C., and their zeal to get something in place. They ought to empower the states to be a partner in this effort. And Utah, we're leading out. And I expect that other states could lead out too if they were allowed to.
And finally, sir, what do you think about the health care bill passed by the House on Saturday?
Well, I'm just concerned about anything that was going to be that massive. Look at anybody's numbers of what the cost is going to be for the House version of this health care reform. And we can't afford it. The states can't afford it. This is the largest unfunded mandate in the history of probably our country, at a time when the states could ill afford to have increasing burdens on their budgets. And so it may bankrupt the country. We're going to be spending more money that we don't have. That means we have to borrow more. We're going to pass on this expense to generations yet unborn. And so I'm very concerned about the House version. I'm concerned about what I hear about the Senate version, so it doesn't look like I find a lot of comfort there, but I think there is at least a little more flexibility and less of a burden of unfunded mandate to the state. I hope that we can maybe get some kind of modification of the House version in the Senate version, because the House version is just not only unacceptable, but I think unworkable.
Governor, thanks for your time.
Thank you.